So achalasia is a condition in which there's been an injury to the nerves supplying the lower esophageal sphincter. Now that muscle surrounds the bottom of the esophagus and is normally closed except when you swallow, in which case it opens to allow the food to go into the stomach. In achalasia, the nerves are damaged so that it's unable to coordinate itself with the rest of swallowing, so that relaxation of the sphincter doesn't happen, which means that the food that's been swallowed has made its way down the esophagus but then can't get into the stomach because the muscle has remained closed. Eventually, food does gradually seep into the stomach for a variety of reasons, but it's at the expense of dilatation of the esophagus and damage to the lining of the esophagus as the process continues over time. Eosinophilic esophagitis leads to some similar symptoms in the sense that the patient perceives food going down slowly and it takes longer for food to get to the stomach and it's uncomfortable, but the mechanisms that underlie that are very different. In eosinophilic esophagitis, the lower esophageal sphincter is essentially normal, whereas the wall of the esophagus becomes stiff and tense and non-compliant as a result of chronic inflammation and fibrosis, so that peristalsis is less effective.
Whenever we think of a patient, we always start with the symptoms, and symptoms such as problems with swallowing or vomiting are quite commonplace. And whenever we think of those symptoms, we think of a list of different diseases that might cause those symptoms. For those types of problems, the list ends up being quite small, and they include reflux disease, eosinophilic esophagitis, and achalasia. Achalasia is a disease of the nerves of the esophagus, the lower part of the esophagus, in which it squeezes too much and doesn't allow the contents to go down. Eosinophilic esophagitis, in contrast, is an allergic inflammatory disease that causes the esophagus not to work as well as it should, leading to similar kinds of symptoms.